Unveiling the early warnings. 5 subtle signs of kidney trouble before it's too late. The kidneys, often working silently in the background, perform an impressive daily feat, filtering waste and maintaining fluid balance with minimal fuss. However, when these vital organs start to falter, subtle yet significant signs emerge, often overlooked as mere everyday occurrences. Recognizing these early indicators is crucial, especially given the close association between diabetes and kidney deterioration worldwide. One of the most overlooked signs is foamy urine. If you notice persistent foam in the toilet bowl after urination, it could indicate the presence of protein in your urine, a potential red flag for kidney strain. A study titled Foamy Urine, Is This a Sign of Kidney Disease? By Keitan et al., https://pmc.ncbi.nlm/articles/pmc68322055, revealed that only about 1/3 of individuals complaining of foamy urine had genuine proteinuria issues, but these cases were directly linked to early-stage chronic kidney disease, CKD. Another study by Kong et al., https://pmc.ncbi.nlm/h.gov/articles/pmc3539097, found that 20% of patients with overt proteinuria had higher creatinine and phosphate levels, which are key risk factors. Diabetics are particularly susceptible to this, as elevated blood sugar levels can damage the filters over time, leading to protein leakage. Ankle swelling, or edema, is another subtle sign that should not be ignored. Puffy feet or ankles by the end of the day, leaving sock marks or tight shoe impressions, are clear indicators of the kidney's failure to eliminate excess fluid and salt effectively. Healthy kidneys retain albumin in the blood to prevent fluid pooling, but when protein levels drop in the blood and rise in the urine, swelling occurs due to gravity's pull. Research from the relationship between edema and body functions in patients, https://pubmed.ncbi.nlm/nih.gov/360000120, highlights that lower leg puffiness is common in individuals with CKD, linking it to falls and reduced mobility. In the U.S. alone, over 37 million people have CKD without knowing it, and swelling is a frequently overlooked clue. High blood pressure is a silent yet powerful indicator of kidney strain. Uncontrolled hypertension can damage the nephrons over time, turning mild rises into a catalyst for kidney failure. Diabetes exacerbates this issue, as high sugar levels and pressure work in tandem to wreak havoc on the filters. The CITE study on Indian type 2 diabetes patients revealed a 32% CKD rate among those with systolic blood pressure, BP, over 140, poor sugar control, and longer diabetes duration. Age over 60 doubled the odds, underscoring the insidious nature of this silent harm. Frequent nighttime trips to the bathroom, or nocturia, is another sign that should prompt concern. Waking up once or twice to urinate at night can disrupt sleep and is often a sign of the kidney's inability to manage fluid retention during the day, leading to excessive fluid release during rest. A study titled Nocturia as an Unrecognized Symptom of Uncontrolled Hypertension, https://pubmed.ncbi.nlm/nih.gov/308271133, found that treated high BP patients with night trips were 2.47 times more likely to have poor control, even after accounting for diabetes. Diabetes intensifies this issue, as high sugar levels pull water into the urine, overwhelming the kidneys. Diabetes is a common thread that ties all these signs together, leading to diabetic nephropathy in most end-stage cases. The CITE study reported a 32% CKD rate in Indian T2D patients, with factors like HbA1c over 7%, tobacco use, and non-vegetarian diets exacerbating the issue. START India interim data revealed that over 40% of T2DM individuals had CKD, yet 80% had an estimated glomerular filtration rate, eGFR, above 60. High blood pressure and sugar levels scar the filters, triggering symptoms like foam, swelling, fatigue, and frequent nighttime trips to the bathroom. Annual screenings for microalbuminuria can catch these issues early before symptoms become more severe. The U.S. statistics are alarming, with 1 in 7 adults hiding CKD, and foamy urine being an early hint of proteinuria. Kang's study found 31.6% microalbuminuria in tested individuals with foamy urine, with serum creatinine as a top risk factor. The CITE study, https://pmc.ncbi.nlm, nih.gov/articles/pmc120830097, reported a 32% CKD rate in 3325 Indians, emphasizing the need for 6-month checks for diabetics or those with high blood pressure. Edema and nocturia are linked to poor control, further emphasizing the importance of early detection. If you experience any of these subtle signs, it's crucial to take action promptly. Visit your healthcare provider for a urine albumin-creatinine ratio test, eGFR assessment, and comprehensive blood work. Diabetics, in particular, should undergo annual screenings, regardless of how they feel. Simple lifestyle changes, such as reducing salt intake, keeping blood sugar levels under control, aiming for HbA1c below 7%, engaging in daily walks, and quitting smoking, can significantly protect your kidneys. These early interventions can prevent the dire consequences of dialysis, so listen to your body and take proactive steps towards kidney health.